We know, sadly, how vulnerable people in care homes are to COVID-19. What is the situation on the front line?
Hello, good morning. I think it is very, very challenging, and having been clearly identified as the biggest risk group, we were suddenly forgotten about really in the planning, and I think there's been a very reactive approach. So we've got members who are really struggling with the PPE. They're struggling with making sure that they're keeping their staff protected as well as the residents, of course. But with staffing, very early on, we started to realise that we were going to see that really challenging sickness rate where people were self-isolating, and the whole thing kind of exploded very, very quickly. But providers were very responsible very early on and started to shut down the services to open visiting, although they are still enabling people to come in where the need arises. And I think what we're challenged with is that despite a number of promises and a number of announcements that have been made, for example, the 1.6 billion that was given for social care, a lot of providers have no idea where that is. They're not being, they haven't even got the notification of annual increases for the services. So my members are on averaging about £550 a week, and on that, which is less than £4 an hour, and on that they're trying to manage this pandemic without much support coming from anywhere. And I think that's the challenge our members are facing at this moment in time, and all providers.
It's interesting to hear you say that you feel that care homes were initially forgotten about, because right up to the 13th of March, the care homes were being told by the government that it remains very unlikely that people receiving care in a care home or the community will become infected. Do you think that we were just very slow to realise just what the crisis in care homes could be?
Yeah, and I think that's, that's what it was, reactive. It's never been proactive, because a lot of it could have been avoided if the testing had been in place very, very quickly. And we'd thought about all those things, and the PPE wasn't being diverted just to the NHS. So our own suppliers were telling us they couldn't supply us with the PPE because it was all being diverted to the NHS, leaving the care home sector completely exposed. So I think it's been reactive, very, very slow coming. And even now, although the announcements have been made about testing, what we're now being told is that somebody with a home in Norfolk is being told their nearest test centre is Sheffield. Well, there's no planning. Don't make announcements unless we know what the plan is behind it, because it doesn't actually help or support us as providers. It doesn't create confidence in our staff who are working, this brilliant team of staff out there who have been doing this job undervalued year on year for decades, is suddenly now in the front line, and we're trying our utmost to try and keep them safe.
I'm interested to know a bit as well about whether you think that the kind of official statistics on care homes are matching the reality of what is happening inside our care homes. The daily death figures, of course, only include those people who have died after testing positive in hospital for COVID-19. Matt Hancock said on Thursday only 15% of care homes have seen outbreaks. Do you think that sounds right?
Well, I think it's very difficult, because I've seen the numbers that are being talked about, and until testing is done, we don't know. I have an uncle who's currently he's got cancer, and he is at end of life care. So there are expected deaths that will occur in services, but without testing, without actually at the very beginning starting to look at the statistical evidence, it's very difficult to say where we are with the number of deaths. And actually, care homes generally have always been a very supportive environment for all providers. It's a home for all residents. It's a home from home. And there are a lot of people in these services and the families out there who are watching all of this unfold, and they'll be feeling very, very, very worried. So we need to be we need to be responsible about how we reflect this. Of course, there will be deaths. I'm not denying that there are deaths, and the numbers we won't be able to confirm until and unless the data's analysed.
Understood. A quick thought from you, because we are running out of time, but I did want to get your opinion on the badge that Matt Hancock announced earlier, a badge of honour for carers. Is that a good move, or is it a little bit, I don't know, patronising?
Well, I think it's a symbol, and if people like the fact that it's a symbol, then that's good. I'm more interested in the tangible, the tangible support that they can give us, and I think we need the money that local authorities have been given being passported through to us more than I need to focus on a badge.